twice a day drive to an infusion center for 7 months. I can't imagine anybody feeling like that would be an okay option.
When I was having to go into the clinic versus having infusions at home, it was probably one of the most stressful things I've done. It was about a 40-mile drive one way. I would have to leave my house at like 6 a.m. I dropped my son off at daycare or school, depending on how old he was. And then I would go down and I would be at the infusion clinic for the entire day.
Had I had to go to an infusion center, that would have been life-stopping, not just life-altering. I would have had to not participate in life.
I have memories of watching the Cubs win the World Series with my mom on TV, doing my IV treatment at home. I would have just been stuck in the hospital.
I got my line and started my antibiotics, and 2 days later flew to my OLE annual conference and ran a conference while infusing IV antibiotics.
Being able to live my life without really thinking about it all the time. I can go play soccer, I can go jump on a flight, I can go ski, I can go to work, I can go to school.
Travel the world and perform and go to the office with an IV antibiotic hooked up to you and no one will know.
Home infusions, when done well, when done safely, when done holistically, are safe and the most effective and cost reducing for the whole system. And we need to remove any kind of bureaucracy barriers in order to get those infusions done.
I used to tell people I am a full-time patient and a part-time mother. Once that switched over to home infusions, I now can tell people I am a full-time mom and a part-time patient. And that has been the best feeling of my entire life.